The latest is that it is spreading fast, and the head of the CDC warns the U.S. will probably face one of its biggest public health emergencies before the end of this year, as it deals with both COVID-19 and the flu at the same time. Oh boy, many Americans are desperate for answers, as you know. Look at these long lines in several states, hundreds of cars just sitting there waiting to be tested. Anthony?
At least 3 states, Alabama, Utah, and Florida, just reported a record one-day number of coronavirus-related deaths. Our lead national correspondent, David Begnaud, is in Orlando. David, good morning.
Anthony, good morning. Florida saw its largest increase in hospitalizations yesterday. More than any other state, 300 people went into the hospital just yesterday with coronavirus. This morning, you're going to hear from the man who is leading the state's effort. We're in the middle of hurricane season. He's used to dealing with hurricane stuff right now. But he says over the last 90 days, coronavirus's response here in Florida has consumed more time and resources than a Category 5 hurricane. But what's interesting, he says, is during a hurricane, everybody for the most part is on the same page. Get out or stay safe and hunker down. He says in this case, it's based on what your political persuasion is or who you're getting your information from. And he says almost no one is on the same page.
Working hurricanes are sprints. This thing's a marathon.
That is Jared Moskowitz, director of Florida's Division of Emergency Management. His agency is at the center of the state's coronavirus response, setting up testing sites, delivering critical supplies, and allocating personnel across Florida. He says this is the largest operation in state history, and it has been complicated by misinformation and politics.
When a Category 5 hits, nobody argues whether it was a Category 5. No one says, no, it was a Category 2. And in this disaster, we're arguing over everything.
In Miami-Dade, more than 30% of all coronavirus tests came back positive on Tuesday. And with hospitalizations surging, Miami's mayor says more rollbacks may be necessary.
You know, there is a significant amount of pressure right now for us to shut down at some level.
Out west, it is a similar story in Los Angeles County. New cases and hospitalizations hit record highs Tuesday. Listen to what the LA Mayor Eric Garcetti said before those numbers were announced.
Red is when everything shuts down again, everything, to our strictest level. And so I do want to warn people that we're close to that.
The outbreak is also accelerating in South Carolina. On Tuesday, Senator Lindsey Graham was briefed by hospital administrators. This is what he had to say afterwards.
We see a dramatic increase in the number of cases, and hospitals are facing severe staffing shortages.
With the national outbreak still raging, the city of Philadelphia now says it will not allow any public gatherings over 50 people until early 2021. Officials say that could include crowds at professional sporting events this season. The director of the CDC, Dr. Robert Redfield, warns that the worst may still be ahead when the pandemic combines with the flu season.
I do think the fall and the winter of 2020 and 2021 are going to be probably one of the most difficult times that we've experienced in American public health.
Please, man, just take it serious.
That is George Guerrero. His 39-year-old sister, Renata McGuire, died 2 weeks after being hospitalized with coronavirus. He says she was a devoted mother to 6 children. Now he's caring for them, along with 4 of his own.
It's still hard to deal with, man. You know, she should still be here.
Renata did have underlying conditions with her kidneys that she had been treated for before she fell sick with the coronavirus. Back here in the state of Florida, they are doing record testing, but they are still dealing with the problem of getting test results back fast enough. Tony, the head of the Emergency Management Agency, told us yesterday they have more than 12 contracts with 12 different companies to keep testing people. He said at one point a company called and said, listen, it's too many tests, it's taking us too much, don't send us any more tests for 48 hours. He basically fired them on the spot and said, go find me somebody better who can do it faster, because the demand requires that.
It's good news, David. The testing is not too effective if you don't get those results quickly. Thank you very much.